So patients who have normal thyroid function tests, meaning normal TSH and a normal free T4, this is a question we got on TikTok, but they have positive thyroid antibodies and feel like their primary care physician isn't offering them any guidance. Yes, I do recommend seeing an endocrinologist because they can delve further into signs and symptoms that you're having. But truly, with a normal TSH, normal free T4, you do not have hypothyroidism. However, the positive thyroid antibodies are telling an endocrinologist that you have the propensity of developing hypothyroidism in the future. So in my opinion, what I would do in those cases is I would check women's TSH level once a year to see if it was rising from 1 to 2 to 3. Once it was 3 or higher, and it was a younger woman, and they, as I said, had the positive thyroid antibodies, I would talk to them about going on some levothyroxine to help prevent further destruction of the thyroid. Because what's happening in hypothyroidism, you inherited those thyroid antibodies. So having a family history of hypothyroidism really makes you want to get your thyroid antibodies checked along with the thyroid function tests, just to see if you inherited it. Well, those antibodies get activated in adulthood. We're not sure exactly what the genetic or what the molecular trigger is that activates those antibodies, but we do know stress activates them. Stress can be in the form of you're eating a lot of processed foods, you're not getting enough sleep, you are changing jobs, and that could be for a good reason or a bad reason. You are changing your marital status, again, a good or bad reason. Changing where you live. All of those are stressors to your body, or even a cold or a flu could activate those thyroid antibodies. Once activated, they start to attack the thyroid gland, which is this little butterfly gland right here in your neck, and start to replace it with scar tissue. Once 90% of the gland is replaced with scar tissue, that's when you start to see the TSH level go out of the normal range. And the normal range is usually about 0.5 to 5. It depends on your laboratory. So as I said, if I see someone's TSH slowly increasing, it's telling me something's going on in that gland, and I want to prevent further destruction. And you can do that with the medications. Other ways you can help decrease those thyroid antibodies is with good lifestyle behaviors, such as eating more of a Mediterranean diet. Get processed crap out of your life, if at all possible. If you can't do it 100%, at least decrease it to where it's only 10 or 20% of your entire eating pattern. Getting a good night's sleep, decreasing stress as much as you can with meditating, going on walks, especially in nature, hanging out with your dogs or your kids, and then also just getting into a good movement pattern, at least 10 minutes a day where you're just moving your whole body. Those habits can help the thyroid antibodies from not becoming active, which then will help you prolong the life of your thyroid.